Good Places, Better Health is about responding to the challenges we face in creating safe and positive environments which nurture better and more equal health and well-being in Scotland's young children. The challenge was that the places where children grow up are influenced by many factors and many players. The project needed to find a way to break down professional silos, ensure partnerships for shared outcomes, encourage local engagement and ownership. One of the founding principles was to seek a logical model which would take into account the complex systems which Good Places, Better Health sought to address. One that would support subsequent review of evidence, agreement of indicators, and discussion with practitioners on interventions. One such model was developed by the WHO. However, was modified by the Good Places, Better Health team to consider those issues which included the risk of exposure or the risk that exposure would lead to a specified health effect. The resultant model was the modified Dipsy, covering elements of driving forces, pressures, state, exposure, effects, actions. Driving forces. At a society level, the social, economic and political influences on the environment. Pressures. Those factors resulting from drivers which act to modify or change the environmental state. State. The resultant environment which has been modified due to the pressure. Exposure. Any human interaction with the modified environment. Effects. The effects on human health. Actions. Policy and practice designed to address particular factors identified in the chain. In communicating and applying the new approach, the modified Dipsy model retains the critical axis of health and physical environment at its core. In keeping with the philosophy of Good Places, Better Health, it also affords cross-cutting policy relevance by recognising a spectrum of contextual issues which affect the transition from these environmental states to exposure and onto health outcomes, whether positive or negative.
We felt we needed a structure to bring people together to discuss the issues and to have a way of sensibly reporting the discussions that we had with people. We found a model which the World Health Organization had come up with. We liked it, we could see how we could use it. It was, for us, missing a couple of things which we added in, and so we got the modified Dipsy. The benefits are that it begins to give us a structure for discussion and ensure that we bring together people who represent lots and lots of different areas of government or policy or the academic sector, covering both place and health, and that we can have a conversation with them which is structured, which brings in all of the discussions that we need to have, and which then allows everyone to discuss on an equal basis. And then we have a simple way of reporting back.
Specifically, the modified Dipsy model focuses on actions.
The whole point of Good Places, Better Health was to establish what needed to be done about the places in which children are raised to improve their health and their long-term health outcomes. The whole focus was to create ideas for actions and interventions which could be taken to other areas of government to explore how much of this could be done given the constraints in which they work.
The problem framing team developed new ways of communicating the model using a mind map format, featuring a number of contributory or interacting factors or chains.
The mind maps are much more accessible to most people because a lot of people have worked with them, and they're much easier to work with when we're mapping out all the various issues which will influence each layer of the model as we go down. This mind map looks at a particular aspect of children's neighbourhoods, and it's an aspect around whether or not they've got play areas and green spaces close to home. And it looks both down to how that impacts on health through physical inactivity, but also it looks to say, well, what is it that's creating neighbourhoods without nice, attractive green spaces and play areas? So it looks first of all about whether or not they were provided or they've just been lost, and things like no ball game signs. And then why then do we have neighbourhoods like that in this day and age, and it starts to think about the policies and the decisions which are made either at a local or national level which are creating places like this. Having built up a picture of what's happening and why it's happening, we then work with groups or through the research evidence to say, well, what could we then do to influence this?
The Good Places Better Health team found the mind map a particularly useful tool in engaging and enabling work at a local level. Workshops involving a dozen or so interested individuals encouraged cross-sectoral discussions of the issues and gives a broader approach to identifying suitable interventions.
We started for each of the health outcomes with a workshop or a couple of workshops, depending on how wide the issues were, where we discussed what should be covered in the maps and the models with a range of experts, both from policy, academics, leading practitioners, and people who were considered to be experts in the field. So we had people from the voluntary sector there as well. From those discussions, we started to draft up the models. We then gave them to the research arm of Good Places Better Health, the EDFIS consortium, and they did literature reviews and looked at the research evidence and used that to refine the ones that we had created. And then we took those combined pictures of what was going on out to workshops of practitioners, and they gave us a very grounded view of whether or not these models made sense to them, whether there was anything missing, and what additional actions might be taken.
The work of Good Places Better Health and their development of the modified Dipsy model represents a significant investment in developing a framework and a tool for future policy development, the value of which now lies in the ability to apply the approach to new topics to help achieve a healthier Scotland.